Welcome to Green and Red, Scrappy Politics for Scrappy People, a regular podcast on radical environmental and anti-capitalist politics, brought to you by Bob Bezruchka and Scott Parkin.
Welcome to the silky smooth sounds of the Green and Red podcast. I'm your co-host, Scott Parkin, in Berkeley, California today. And as always, I am joined by Bob Bezruchka in Houston, Texas. And really looking forward to today's show. We are talking with Dr. and Professor Stephen Bezruchka, who is an associate teaching professor emeritus in the Department of Health Systems and Population Health and Global Health at the School of Public Health, University of Washington, where you've received all kinds of awards for teaching and community service and mentorship. You have written many books, including A Guide to Tracking in Nepal, great stories about Nepal, and Nepali for Trackers, The Pocket Doctor, Passport for Healthy Travel. And today we're going to be talking about your most recent book, Inequality Kills Us All. And also, I think you are on the board of the Washington Physicians for Social Responsibility, which is a really well-known organization, which I believe is one Nobel Prizes are a really esteemed and acknowledged scholar. So we're really happy to have you here. Thanks for joining us.
My pleasure.
Thanks. Before we get to the book, we were just going to start with a question about the book, but then last night, Scott and I ran across this little quote. So I thought we'd start with that because it fits perfectly. There's a guy running for the Senate in Virginia, a hung cow, who's a Republican, and asked about healthcare yesterday. He responded, "No one in the United States is, oh my gosh, I will die if I don't have healthcare." So I just wondered if, I don't know if you saw that or not, but I just wondered what you thought of that. The guy running for Senate says nobody's concerned about healthcare and dying.
So this is a big conundrum. So I played doctor for some 40 years. I was an emergency physician for 30 years. I taught doctors in Nepal. And I went into medicine from mathematics thinking that it was such a useful service to others. And along the way, I had to change my mind. We in the United States conflate health and healthcare. We use the phrase, we access health, pay for health, get health, when it's really all about healthcare. We insure healthcare, pay for healthcare, access healthcare. How much does healthcare do to make us healthy? There's a few contradictions here. To begin with, if we add up how much money we spend on healthcare, ends up being a sixth of our total economy, $4.5 trillion in 2022, or about $13,000 per person. And that's about half of what the entire world spends on healthcare. So if healthcare were really that important, we should be one of the healthiest countries in the world. What does it mean to be healthy? I make the point that if you're dead, you can't be healthy. So the easiest diagnosis I could make in the emergency department was that somebody was dead. My job was done. I had to fill out a death certificate, and that was that. I began looking at mortality measures, whether you're alive or dead, various forms, whether you died in infancy, in childbirth, or as an old person. Keep track of these mortality rates, and they're very good estimates for other countries. So we could ask the question, given that we spend half of the world's healthcare bill, how alive are we? And it turns out that some 43 other countries, all the other rich ones and quite a few poor ones, have longer lives than we do. That's disturbing. I'm sure, Bob and Scott, you'd rather be alive than dead, and you'd rather live a longer life than a shorter, sicker one. I'm with you there. But we live rather sick and short lives. And if you could say what I'm telling you is absolute nonsense, it's false. But the studies on this, the collection of death data are very good. And nobody who asks the question, how alive are we, will say that we're the healthiest country in the world or among the healthiest. We used to be. Back in the 1950s, although our lives were shorter, we were one of the 5 or so longest lived countries in the world. Since then, other countries have seen their lives become longer at a faster rate than in the United States. And right now, the length of our lives, life expectancy, is the same as that of Cuba. And who is Cuba? It's a country we've been strangling since 1962, and it's as healthy as we are. That doesn't compute unless you start asking questions that are really difficult. Notice that none of what I'm telling you is a campaign issue right now. It's never brought up. It's a topic that can't be discussed. I've several times tried ways to make it a presidential campaign issue or even a local campaign issue, but if somebody brings it up, they're shooting themselves in the foot.
Dr. Bezruchka, you've argued that combating inequality might be the best way to ensure improved health. Why is that?
Think about inequality. What does it mean? Other people have more than me, or I have more than other people. That creates a lot of stress. So the people who have more, they put those who are below them down. And remember, the United States is a classless society. But of course, that's not true. More inequality creates more stress, and stress is the big killer. It's the 21st century tobacco. We don't smoke much anymore. So what has replaced tobacco as a bad thing? It's chronic stress. To paint a vivid picture of this, let's consider something called air rage. Let's consider behaviors on passenger airplanes. And let's look at passenger airplanes that have no first-class cabin and those that do. Air rage, things like intoxicating behaviors, sexual abuse, smoking in the lavatory, getting angry and pushing other people, or banging on the place where you put your luggage to try and close the door. If you've flown in planes, air rage. And if the plane has a first-class cabin, there's more air rage. If you enter through the first-class cabin as opposed to jumbo jets where you enter behind the first-class cabin, there's more air rage in first class. The people sitting up there don't want to see us plebeians walking by. That's an example of class differences or inequalities, inequities that produce rage, which is not a healthy phenomenon. What you find is where there's more inequality in a society, and the thing that's easiest to measure is income inequality, because at least theoretically, we report our incomes on our tax returns, and so we have those data. Wealth inequality probably matters more, but we hide our wealth. They're offshored in Panama or the Cayman Islands. But income inequality can be well tracked, and the more income inequality a country has, the worse its health. For among the reasons, one of them I mentioned, there's more stress because of the social comparisons, economic comparisons we make. Another one is, with more inequality, the rich want to get privilege that the rest of us don't have. They send their children to private schools. They'll have concierge doctors. They can call them up anytime and get help. And they pay politicians to make sure that they don't have to pay tax. So those are two reasons, at least, the stress of inequality and the way the rich game their system, that points out that inequality is bad for us. And as the title of my book suggests, it kills us.
Along with that, you talk about the concept of social murder. In fact, I think that's in your dedication. which I think I've heard the phrase before, but it's really interesting and I think very important. You want to discuss that? Tell us what that is.
Yeah, Frederick Engels, back I think it was 1846, was looking at communities in England, and it was back in the 1800s that people began noticing, epidemiologists, people who tracked health outcomes, that poorer people had poorer health. If they wanted to see where the carts went out to pick up those to be buried, they were always in poor communities. And they weren't dying of gunshot wounds or that kind of behavioral violence. Instead, they were dying of being poor. Frederick Engels said that this process is a crime that is murder. It's murder by being by the social structure of society that privileges some and takes away the privilege of others. And so by any name, it is murder. The term resurfaced in 1969 when Johann Galtung called up something called structural violence. We understand behavioral violence. Somebody points a gun, pulls the trigger, a hole appears, blood comes out, and that's pretty clear. Structural violence is where, for example, you create a lot of inequality. And because of that inequality, people die. And there's no bullet hole, there's no gun or trigger being pulled. So social murder and structural violence are similar descriptors of the same phenomenon. And one should argue that form of violence, structural violence, is in fact the leading killer in society.
Let me just follow up on that for a minute, because so much of our health discussion, I think, is based on personal issues or kind of moral issues, right? You're immoral, you drink or you eat fast food or whatever. And you pointed out, I don't know if you came up with it or somebody else, poverty is a carcinogen. And so what you just said, I think to us at least makes perfect sense, right? But I think most Americans don't see it that way. We're focusing on these kind of personal things. Why is that? Why don't we understand these kind of larger issues?
The American society believes in the American dream. You work hard and by the time you reach old age, you're going to be a billionaire. Or the other way of phrasing it is we're an individual society. We're a society of individuals, and each of us is responsible for bettering our own condition and rising up the economic ladder to rub shoulders with the billionaires. So if the focus is on the individual, then what you've got to do is not smoke, eat right, exercise, use a condom. Those are individual behaviors. And I used to believe that. As an emergency physician, I used to rail against my smokers. I thought, here they are practicing this habit to make them sick, and I got to try and treat them. Then when I looked at the ranking of countries by life expectancy, remember I said we're tied with Cuba at 44th. The longest lived country is Japan. Now, I discovered, I had been to Japan and observed this as well, but Japan has, out of all the top 45 countries, the highest proportion of men smoking cigarettes. Today's data, about 45% of Japanese men smoke cigarettes. About 15% of American men smoke cigarettes. So if I told you that's the reason Japan's so healthy, they all smoke cigarettes, you'd be wise to tune me out. But it does suggest that a personal behavior, one that most of us would agree is not good for you, cannot explain the health differences between Japan and the United States. Let's address those health differences another way to get a sense of how important they are. Japan's life expectancy is about almost 85 years, and the United States is around 78 years. There's a 7-year gap 7 life expectancy year gap between the United States and Japan. Is that just a few more years drooling in a nursing home? If that's the case, maybe it doesn't really matter, that small difference between the United States and Japan. But another way to look at it is to say, what's the leading disease killer in the United States? Turns out to be heart disease. Almost half of everybody in this country will die from heart disease. What's the second leading killer? Cancer. It kills a very high proportion. And in 2022, the year I'm reporting these data, the third leading killer were unintentional injuries. Not just shootings, but fentanyl overdoses. We have a high rate of opioid use and overdoses in this country, and other forms of violence. If we eradicated those 3 leading causes of death, we'd almost be as healthy as Japan, as long-lived as Japan. So I argue this is a huge gap. We really die much younger, are sicker, have more diseases, and you can't find data to contradict this. And it's not a secret. Everything I say is available on the National Center for Vital Statistics reports. And sometimes maybe once a year, there will be a newspaper headline, U.S. life expectancy dropped for the second or third year. Our life expectancy now is about what it was in 1996. And we're not seeing the health improvements that so many other countries are.
Yeah, well, I want to ask about the health Olympics, but I have another question related to that. So thinking about some of the structural violence, things that play into those 3 leading categories, health or stress is the sort of big motivator, what's really pushing that. But is that where we see things like diet, also alcohol consumption, things like that contributing as well? Is that like part of this sort of this poverty element? There's I see lots of headlines about America being one of the most obese countries in the world, for example.
Yes, we're a highly stressed society. And that's Gallup polls, Pew Global, when they rank countries by stress. Now, it's hard to get biological samples of the human population and gauge their stress that way. So most of these surveys just ask people how stressed they are on a scale of 1 to 10 or something like that. And we typically now rank in the top 5. I can show you a slide of the top 10 most highly stressed countries in the world, and the United States is right up there. As I mentioned with the air rage, we're quite stressed by the inequality in our society. How do we cope with stress? First of all, what is stress? Stress is a physiological response in the body that one of you is in Texas and one of you is in San Francisco. Suppose, and I'm in Seattle, suppose in San Francisco or Seattle, the big one started happening. Suddenly the room where I'm sitting started shaking, and similarly in San Francisco, all of a sudden, without even any thought on our part, we would secrete adrenaline. It would send blood to our muscles. Our pupils would dilate. We'd breathe quickly, and I'd get out of this building before it collapses on me. It would save my life. So an acute stress response, a response to some horrible thing happening, saves your life. It's really important. Along with adrenaline, another hormone is released, cortisol, which says, I've just had breakfast. Stop digesting breakfast because you may be dead if you are concerned with digesting breakfast. If you're a kid, hit puberty next week. You got to save your life now, and so on. We have all these regulatory mechanisms that prime us to get out of the danger that the stress has produced, and then Once I'm out of the shaking building and I haven't been toppled by a tree, I heave a sigh of relief and my heart slows down, my breathing slows down, and so on. So stress saves your life in those circumstances. However, most of us suffer from chronic stress. We are worried about what's going to happen with the forthcoming election. Will the check come in time? Will my teenager get a probation report from the school? Will my significant other come home and beat me? That's chronic stress. And we secrete the same hormones, and especially cortisol, and we find chronic stress uncomfortable. So one of the ways to lower levels of cortisol, the stress hormone, is to, for example, eat comfort foods. So we eat sugar. Sugar decreases cortisol secretion. We eat fats. Fats decrease cortisol secretion. And we used to eat 2 or 3 meals a day at meal times, cooked at home and eaten at home. Now we have food available 24 hours a day. It's cheap. It can be delivered anytime. And we eat a lot of it to try and cope with the stress we're under. So our waistlines get bigger, and that's what comfort foods do. Diet, so that's where diet comes in. Exercise, mostly I do mouse work. I move this thing across a pad. That doesn't take a lot of calories. We're robbed of the opportunity to burn calories, and so they stay on us. It's just something that eventually does us in.
Do you want to, so the Health Olympics is actually a very interesting part of your book. Do you want to explain to us about that?
Okay, so what I'm gonna do is share my screen.
And for the audience listening, we'll share stuff in the show notes for this.
So do you see a bar graph with life expectancy on the vertical axis and 45 countries listed in order of length of life? And there's Japan, the longest lived country. Oh, and these data are taken from the United Nations Human Development Report published earlier this year. They're data for 2022. And what do you see? There's the United States in the red, and there's Japan with the gold medal. I'm going to do a talk in 2.5 hours to a group of students studying healthcare administration. And I'm going to point out this graph and ask them about it. And you can see the countries listed there on the bottom. They're all the other rich countries, Japan being the highest. These are only UN countries. Taiwan is not there, and Taiwan is, of course, healthier than we are. But these are the best data that I can find that exist. Notice countries like Slovenia or Kuwait or Chile or Thailand or China or Turkey. People there have longer lives than we do. That for the richest country in world history that spends half of the world's healthcare bill. And there we are tied with Cuba. Back in the let's rewind the date there from 2022. Back in the 1950s, these life expectancy numbers were lower, but we were somewhere in the top 5 or so countries. And when I went to medical school in 1970, we were 17. We were here. When I went to so that was 1970. I went to public health school in 1992 trying to figure out what's going on here. So we were 22nd then. 2 years ago, we were 30. So what happens is, and not always, we keep falling further behind. I called this the Health Olympics. Countries compete in Olympic events and I'm only suggesting the race is how long we live. Given the circumstances, we actually wouldn't be there for the final day's race. We would have been eliminated in the trials. Shall I explore this more, or shall I stop sharing?
If there's more to it, sure.
It's like I said, Japan smokes the most.
Yeah.
China, actually. Men. For women, don't smoke much in Japan, but if I showed you life expectancy for men or women separately, it wouldn't be much different than this. The important thing to recognize, a lot of poorer countries here. Being a rich country like the United States doesn't absolve us of being dead first. I'll stop sharing and we'll move on perhaps to something else.
Okay. You mentioned a minute ago that we spent like 4.5 trillion on healthcare. I'm assuming most of that is probably private, like my employer has a healthcare plan and I put into it and they put into it and all that kind of stuff, versus public, right? And one of the things I noticed on the healthcare Olympics is obviously a lot of those countries have public healthcare systems. I spent a lot of time in Italy when everybody I talked to there, no matter what their political views were, right, far left, were really attached to the public healthcare system. How does that fall out in the U.S., that 4.5 trillion? Is most of that kind of privately spent and essentially for profit?
The answer will surprise you. The governments, through Medicare, Medicaid, and a host of similar programs, if you tally up the per person cost that governments spend on medical care in the United States, it is more than any other country spends per person. And as you point out, in Italy, where everybody has healthcare access. We already spend enough to make sure that everybody has access to healthcare without having to pay out of pocket at the time of seeing a healthcare worker. But that's not the system we have. We have a profit care system. That's the system of healthcare in this country. It's incredibly profitable. What's happening now is that we have the Affordable Care Act, which forces you to buy healthcare insurance, and the employer, the employer often offers that as well. It's a very complicated system trying to understand how healthcare is administered in this country and who pays for it. But we already spend enough on healthcare at the government level so that everybody, than any other country. So if we wanted to, we could have a healthcare system for all, Medicare for all, so to speak. But that's not how that would cut into the profit, the incredible profits. And there's being a transition now in healthcare in which private equity funds are buying up practices and hospitals, and also they're getting their fingers into the very big healthcare pie. And most people don't recognize what are private equity funds. The rich and powerful, they want their money to work for them in ways that are transparent. So private equity funds are not listed on the New York Stock Exchange. They're run by a few very highly qualified investors, and you don't know what's going on. But for example, last week I talked to internal medicine residents, and I pointed out that all the practices that private equity funds are taking over, and then it becomes very hard to know what's going on. But we're guaranteed to have a lot of money made in this process.
One understanding in this country is that often Republican voters vote against their own interests, right? They play into the culture war, things like that. And hearing this about private equity is that particularly in red states, red counties, we see higher mortality rates. Poverty is often higher. Mortality rates are often higher. And how do you see these people are voting against their own interests?
You're absolutely right that the places, the red states or the red counties, we can look at it at a county level, their mortality is going up. mortality is going up in general in the United States, and it's going up more in the red states than the blue states. And along comes somebody who says he's going to change that. He's going to make people in those states may not be aware of the mortality increases, but they sure sense something is wrong. Their jobs are gone. Their families are broken up. Nobody's having children anymore. It's too expensive. And along comes somebody who says he's going to make America great again. Oh, they're speaking to me. He's speaking to me. Forget the details. Just that phrase, make America great again. So I thought we could also make healthy again. We used to be one of the healthiest countries. So I got this hat made back in the Trump era. And surprisingly, Robert Kennedy Jr. has produced a hat like that now in his campaign.
Trump does have a concept of a plane, apparently. So,
yeah. So inequality kills. That's half of the picture. The other point I need to make is that early life lasts a lifetime. What do I mean by that? As you go from the erection to the resurrection, the first 1,000 days after the erection, by the time you reach your second birthday, that's 1,000 days, roughly half of your health as an adult has been programmed. Those early years are critically important for the health you enjoy as you age. Healthier countries privilege that period in a variety of ways. The most important way is to give a working woman who's pregnant paid time off after she has her baby. There are only 2 countries in the world that don't give a working woman who's pregnant paid time off after she has her baby. One is, of course, the United States. It said we can't afford it. And the other is Papua New Guinea, half of a big island north of Australia. Only 2 countries in the world with populations of 1 million or more that don't have a nationally mandated paid maternity leave program. Let's take a country like Sweden, much healthier than we are. In Sweden, you have to take 444 days of paid paternity leave. The father has to take 13 weeks. It can be, the rest of it can be split at your full pay. The rest of the second year is optional at 70% pay. In the third year, you can put your child in a Swedish government-run daycare center that's free. And who works in a Swedish government daycare center? You have to have an advanced degree in play, because what's daycare? You're socializing the kids, and you want experts. What's the requirements to work in a U.S. daycare center? Working at minimum pay is about all that's required, and no recent history of sexual abuse of children. So you get what you pay for. So we could, the richest, most powerful country in world history, could certainly afford to have a national mandated paid parental leave program. All we have is the legislation passed in 2020 and 93 that gives a working woman who's worked for a company for a year or more 4 months of unpaid leave, and after that she can be fired. It's not very good for our health. What else can we do in the first 1,000 days? We can reduce poverty. Remember, we have a very unjust taxation system. Who pays the lowest percentage of their federal, state, and local taxes, the lowest percentage in taxes? Turns out to be the richest 400 families. They pay 23% of their income in taxes. In the 1950s, they paid 70% of their income in taxes. So we have decided as a society, because these are political choices we make, to not tax the rich. They should have a free ride, and we'll take the tax burden and not have to make them suffer. We also take out a huge loan. We are highly indebted. About $33 trillion is our how much money we owe to pay back in the future. This is suicide.
In addition to that, because the section I was actually going to be my next question about childhood, how much of that is due to kind of factors like immunization rates or diet or prenatal care, nursing, things like that? I know probably since you worked on that book, the whole vaccination issue has gotten even bigger. And so now you're seeing places like Florida where you're seeing these major outbreaks. How much of that is one of the reasons we have this childhood health crisis?
So going back to our health Olympics, we have mandated vaccinations in this country. Guess what? In Japan, there are no required immunizations. When I teach about Japan in my public health classes, I make a blanket statement. Japan disobeys all the public health rules. They smoke, they have deaths from measles, and if women smoke in Japan, they do so when they're pregnant, believe it or not, because the obstetricians say you got to keep your weight down. So women take up smoking then. Japan breaks all the rules, and how do they manage to do that? There's a concept, two things. One is we destroyed Japan in the Second World War, and then we occupied Japan, and the leader of the occupation was General Douglas MacArthur, and he wrote the Constitution for Japan that put in place the Peace Clause, Article 9, Japan shall never wage war, never maintain a standing army, resolve all disputes peacefully. Now, of course, we want to have Japan arm itself instead of just having a police force. But once something's written into a constitution, it's hard to change, and the Japanese like not having a military presence. Article 23 in the Constitution that Douglas MacArthur wrote for Japan says it's the Japanese government's responsibility to produce a healthy population. And that's not quite the exact words, but that's the intent of Article 23. Another thing MacArthur did was he legislated in 1946 a maximum wage in Japan. Nobody shall make more than 46,000 yen. Another thing MacArthur did was Japan was ruled by 13 zaibatsu, or big corporations. And in his memoirs, he says, you can't have a democracy and have, he also put a democracy clause in the Constitution, gave women the vote. He said, you can't have such concentrations of wealth and power and have a democracy. So he broke up the zaibatsu. Japan was also a rice farming economy, and about 37,000 landowners, kosakunen, owned the land and farmed by 50 million peasants. And again, MacArthur said, this is not fair. So he bought the land from the kosakunen and sold it to the peasants at the same price per hectare and gave them a 30-year interest-free loan to pay off the land. And Japanese don't like loans, so most of them paid off their loans in a year. And the historians call it the most successful land reform program in history. So MacArthur put in place a bunch of policies that historians say were produced the greatest declines in mortality ever seen on the planet. But there's a second factor there, and that is Japanese culture. There's a concept called wa, or social harmony. Japanese people do things together. Do you ever see a lone Japanese tourist? Of course not. Do you ever see a lone American tourist? All the time. They do things together and that is very good for health. And we work as individuals, and we don't cooperate with one another, leading to worse health. I got sidetracked, but immunization, I can take apart. I'm not an anti-vaxxer. I've received the latest COVID-19 booster and everything else. But immunizations are relatively a small player in producing health, as are antibiotics and all the other sort of miracles of medical care. What really has mattered in public health is removing fecal matter from the water and having good disposal of fecal waste. That said, there are actually quite a few million homes in the United States that don't have that kind of sanitation. Again, we fail in the basics and enrich the billionaires.
That's a big deal. If things like immunizations and antibiotics aren't that determinative, so we're talking about larger kind of social factors. What about we're one of the big stories in the last year or so I followed is microplastics, which are now in everything. And we still have one in Flint, Michigan, lead in the water, other poor cities like that. So that's actually more important that kind of antibiotics or.
So one of the issues with environmental pollution whether it's microplastics or lead or smoke from fires, unless it's a very high level of pollutant that you take in a very short period of time that produces an obvious illness. The best example is methylmercury poisoning in Minamata Bay in Japan that was released by a processing factory, and people got very sick. And it was called Minamata disease. It was this physical place. But it took about 10 years to conceptualize and link it to the methylmercury. And the company, the Chiso Corporation, didn't start cleaning up for another 10 years. So environmental pollutants can be very hazardous in high concentrations over short periods of time, but small doses of microplastics or PFAS, the fluorinated alkaline hydrocarbons, small amounts of those over long periods of time, plasticizers, they're very hard to study because you need to have a population and follow them over long periods of time. The recent study looking at carotid artery plaque done in Italy, and when they removed the plaque, they found all these microplastics there, and we find them in Antarctica, down in the oceans. They're certainly not good for us, and how bad they are and whether we can clean them up. That's a tough problem. Be easier to decrease inequality and spend the proceeds on early life, because that's proven.
Just to switch topics a little bit, I'm going to switch to COVID. We've been talking about inequality. In the last 4 years, we saw a huge number of people in the U.S. die from COVID. A huge number of people got sick from COVID. People are suffering now from what they're calling long COVID. I'm wondering if you could actually talk a little bit about the link between inequality and how the U.S. handled the pandemic.
Yeah.
And still handles the pandemic.
Oh, yeah. About 1.1 million people, American people, died of COVID. They're still dying, but in much smaller numbers. And that's more deaths than any other country had. And the rate of deaths, when you divide by the population, somewhere there in the top 10 or so. So there are links between income inequality and COVID deaths by state that appeared about in the literature about 2021 or 2022. There was a study of 84 countries linking COVID deaths to income inequality. The subtitle in the book is COVID-19's Health Lessons for the World, but the book came out in 2022. People have forgotten COVID, though it's still killing us, and we did not do well. And it really had a lot to do with the policy with our president was informed that this was going to be a real disaster. This kind of pandemic has been on the drawing boards for decades, and it was just a matter of when. And it was certainly discounted by Trump. He ignored the advice of Anthony Fauci. Our response was really a disaster. The one thing that was interesting is how we tracked COVID deaths among countries. Johns Hopkins did this, and other places did this. It was an amazingly well-documented scourge, but that's all we did. We watched our mortality in real time and did nothing about it. What could we have done about it? Isolation, I think, is important. Remember, in early 2021, I couldn't do my weekly hike up Tiger Mountain because the governor had said, stay home. That had some repercussions. Schools had problems. I taught my courses on the web. But countries like South Korea, for example, or even China, people isolated themselves, and that was a good containment measure. The immunizations, the COVID vaccines, were certainly not perfect, but they did decrease hospitalizations and deaths in older people especially. But they got a bad rap from the anti-vaxxers. And as I said, I've had all the boosters and things that I'm entitled to, and soon I'm going to get an influenza immunization. They're just not as important as the structural forces, the social murder that happens from the structural violence and the lack of attention to early life. And I can go into much more detail there, but just the very fact that we spend so much on healthcare and have so little to show for it suggests it's not very important player. There's a study out of Stanford University where I went to medical school, came out a couple of years ago, that reviewed all the estimation methods for the effect of medical care on averting mortality. And it said the effect at maximum was about 10%. It's not a big player, but it's certainly a big income generator for the industry.
Pharmaceuticals.
Pharmaceuticals, big pharma. We spend half the world's pharmaceutical bill. And another thing, we consume enormous amounts of psychotropics, pharmaceuticals for mental illness. And I make the point, we have the most mental illness of all countries. That's pretty well documented. And Harvard has a center that tabulates reports on medical illness around the world and produce these reports. And so I think we can make a fair case that America's driving us crazy.
One of the points you make is that a lot of these health issues are really based on political choices. And I think you said in a major study between 1958 and almost 2020, states that had more, let's call them progressive policies on things like civil rights and labor and housing and education and so forth, actually saw their lifespans advance. I believe you compared, was it Connecticut to maybe North Dakota or something like that?
How does that fit in Oklahoma, I think.
But so this isn't just coincidence. These are actually political choices, right?
Yeah. When I talk about these things, somebody will say association does not imply causation. So one has to say what causes something else. And I usually use the argument of the Surgeon General's report in 1964 on smoking and health. Back then, Americans smoked a lot, and as somebody who came of age in the 60s, you smelled cigarette smoke everywhere. You don't now. And so what did the Surgeon General say to infer that smoking caused worse health? He said he had to have many studies by different investigators over different time periods showing the association. There had to be a dose response. More smoking caused worse health. We had to establish, was it a chicken or egg phenomenon? Did you get sick and take up smoking, or did you smoke and get sick? Finally, and another thing, was there a better explanation? And the last thing was, is there biologic plausibility? Is there some biologic mechanism for smoking to cause worse health? So, and when it comes to mental illness, you can use the same criteria to say that the factors in our society are causing mental illness, manifest itself as depression, as anxiety. We live in an age of rage and an age of insecurity. And this is very profitable for Big Pharma to sell us stuff. And if Big Pharma gets caught selling us opioids, telling us, oh, these are great, they'll really help you get through the day, and then, and they won't be addictive, and then their knuckles are wrapped, and nobody goes to jail for causing all these millions of deaths. The Sackler family gets its name taken off buildings, and they pay a little fine. And now
they get to keep the rest of the money.
Oh, yeah. And so now we have alternative sources of opioids, and you can get them through Deliveroo. You don't even have to go down to the seedy part of town and get your fentanyl fix. And young people are using this, and our overdose deaths, they plateaued around 106,000 a year. But as I said, unintentional injuries are now the third leading cause of death. That's how we handle stress. You can get your fix, and it seems to work.
We're getting close, but I have one question that's not really focused in your book, but I live in Texas, which has one of the more restrictive abortion laws. And last year, the infant mortality rate increased by 12.8%, whereas the year before it increased by about 1%. Do you see this kind of continuing, this kind of political attack on these particular issues, which are going to affect our life spans as well?
You raise an absolutely critical point. Infant mortality is a very sensitive indicator of the health status of a population. Back in 1976, a French demographer, Emmanuel Todd, was looking at infant mortality rates in countries of the Soviet Union, and they were starting to rise. So he wrote a book called La Chute Finale, The Final Fall, saying that the Soviet Union is going to collapse. 1976. I don't know when, but the rising infant mortality rates portends something bad. And of course, in 1989, 1991, depending on which number you choose, Berlin Wall fell and the Soviet Union evaporated. Since the fall of the Soviet Union, mortality rates in Russia, for example, increased substantially. So the stress of the collapse produced huge increases in mortality, mostly single middle-aged men drinking themselves to death, plus other causes. The CIA, our Central Intelligence Agency, based on what Emmanuel Todd discovered and what was an American think tank pointing out the sensitivity of infant mortality rates, now monitors these rates in other countries to try and figure out what the future holds. And as you point out, our mortality is going up, and especially our infant mortality is going up, and the United States on the verge of some form of collapse. It's certainly possible. It's not a healthy sign. It's a very important point you raised.
Speaking of collapse, I have my last question is around a different topic, which is my day job is I'm an organizer and campaigner in like climate and environmental field. And I have a couple pieces to this question, but how do you think as the climate crisis is getting worse, we're seeing climate disaster, we're seeing failing infrastructure, as well as climate anxiety and despair, since we've talked a lot about stress being a big motivating factor to a lot of the health problems. But How do you see these different parts of the climate crisis actually also affecting people's health and even the healthcare system?
So consider the climate crisis comparable to our increasing income inequality. Both are like a highly toxic, colorless, odorless, poisonous gas that we're not aware of that's killing us from the usual diseases, and we're doing nothing about it. Our income inequality is rising. The earth is warming up. The rich aren't going to the rich in this country die younger than middle income people in other rich countries. And the rich are going to escape the hazards of the climate crisis. But there are real important comparisons there. All of these things, the world right now, I think, is very unstable. The climate crisis, the various wars, the proxy wars that are going on, the high military expenditure, the increasing debt in the United States, the high debt levels in poor countries. It's creating a cauldron, the likes of which I think, the preceding World War I and the Archduke or preceding World War II. I think the situation is at least as comparably dangerous now, if not more. It's scary. And what can we do? Scott, as you said, you're an activist. Me too. I work with the Washington Physicians for Social Responsibility. In the courses I teach, the students have to do something. They have to become activists to get credit. In other words, they have to take the ideas in the course and spread them into the community. I used to have them do it face to face, but after COVID, they use social media, and they could have a far bigger reach through social media. So now that we're back together face to face, they continue to use social media as an activist tool, and they get graded on how effective they are, how many people they can reach. Back in the face-to-face era, they got 15 people out. That was pretty good. But with the social media reaches, they reach thousands. So I think if you're in the position of having some capability or authority to make activism a part of the course you're teaching and the grade you get, maybe we can have an impact.
If you did that in Texas, they would fire you.
Yes.
There's so much more in my mind, but unless Scott has specific, I was just going to ask you, like, at the end, what do we do? Where do we go from here?
John Kingdon, a political scientist at the University of Michigan, said that for major changes to happen, and he studied major changes in the United States and other countries, he said there are three things were necessary in the United States. First one, people had to be aware of the problem, namely we're dead first and here. They had to be on board to a potential solution, taxing the rich or taking profit out of healthcare or whatever. So need to create awareness, need to agree on a potential solution. And Kingdon said those worked in other countries, but United States needed something else, what he called a transforming event, a shock. Remember when the World Trade Centers came down. So the government already had the Patriot Plan outlined to control the public. And so the collapse of the World Trade Center was the transforming event to allow the government to control the population in the interests of national security. Creating awareness is the most important thing that we can do, along with knowing what the solutions are, namely tax the rich, let them pay at least what they paid in the 1950s, and then be ready for the transforming event, which I don't think is going to take very long, unfortunately.
Thank you so much. This has been fantastic. Inequality Kills Us All, which is a great book. I really enjoyed it. Want to thank our friend Janice Harper for putting me in touch with you. And we should probably talk again sometime because there's so much more to this. Just as a thought aside, what you just mentioned, it's really striking to look at the governmental response to 911 and COVID, right? Whereas on one, you just spend countless amounts of money and you gear down past the patient. And the other one, you don't do much at all. The war gets a lot more money than health. Still,
well, and don't forget
that
healthcare. You want health or healthcare? We've always got to separate those two terms. Right. Otherwise, we'll keep spending more on healthcare and not realizing much health benefit.
Right.
Sorry for.
No, that's a great point. That one of the main things I took from this, which I really probably wouldn't have ever thought of before. No, there was so much in this that was just really important and crucial. It's accessible. It's easy to read. It's really a great contribution. Folks, we've been talking with Dr. Stephen Bezruchka, author of Inequality is Killing Us All. If you like what you hear, please check us out on Facebook. And speaking of social media, check us out on Facebook, Instagram, and Twitter. If you're watching this on YouTube, hit the subscribe button. If you're listening to us on one of the many audio platforms, please give us a rate and review. And then if you really like us, make a donation at go to greenandredpodcast.org and hit the support button or become a patron at patreon.com/greenredpodcast. It's been so great talking to you today. This has been a great show. So really appreciate you coming on.
My pleasure.
Yep. And everyone else out there, make trouble and misbehave, and we'll talk to you again soon.